Salutations, everyone. My name is Indiana, and like most of you, I am a sexual being. Now, out of curiosity, by a show of hands, how many of you would share that you achieved something significant? Okay. By another show of hands, how many of you would willingly disclose that you have or have had an STI? Based on that quick poll, it's accurate to say that most of us would get shy about that topic. With sex positivity leading the sexual revolution, it's much more acceptable to flaunt our sexuality than it is to be concerned about our sexual health. That's because we're eager to get down, but hesitant to discuss, dare I say, the inevitable. Therefore, the implementation of #ShyTalko bridges the gap between sexual expression and sexual education by using crowdsourcing to aid and cure research and supporting the sex-positive movement. Shy in the literal sense means to be bashful, timid and reluctant, or deficient. Using the acronym SHY, meaning sexual health and you, to make that connection, then Talko, a contemporary term that is used to indicate the verbal form of a typo of sorts, like when someone voices information without fact-checking or correcting themselves, and talk being used as discourse, all focusing on sexual well-being. Because in most Western societies, sexual health is considered private matters, which cause people to be bashful and timid about discussing it with peers or partners because of fear of judgment. The topic becomes taboo, leading to people spreading fabrications, misinformation, or gossip as if any conversation outside of conquest or ability is offensive, when truthfully, sexual education is something that we should continue to talk about as long as we have sexual lifestyles. To understand what crowdsourcing is, we first identify the issue, in this case being HIV and other STDs and STIs. Then we decide in which ways the masses can be responsible and contribute to preventative care, cure research, and opening up the verbal traffic and finding the most current and studied answers. In order to build a constructive conversation, the general public must be informed. This is how we are defining crowdsourcing. By being informed, we strengthen preventative care and treatment by holding ourselves and our counterparts responsible at every opportunity presented. With being educated, we include health in the sex-positive conversation. Then civilians are more proactive about cure research and preventative care in order to halt transmission, which creates a domino effect and gets us proactive by participating in clinical trials, sharing personal observations, and ultimately decreasing the number of new infections and being able to study STIs in a contained population. So, why the hashtag? Social media hashtags are the proverbial word of mouth in the digital world, where they are used as tools to contribute to and follow a conversation or topic. Factor in the fact people use social media every day, multiple times a day, that places the ShyTalko hashtag onto timelines, thus further making sexual health a normal conversation. According to the CDC in 2014, people between the ages of 20 to 39 years old make up over 60% of people diagnosed with HIV. Additionally, an estimated 1.2 million adolescents and young adults do not even know their status. Also, nearly 2/3 of Twitter users are aged 18 to 49, and ShyTalko's intended audience are individuals aged 18 to 40. The action plan involves using the ShyTalko hashtag to curate conversation on a bi-weekly basis. During that time, delegated sexual health topics are introduced, asking questions and investigating answers together, to encourage a community where the vast majority include health in their sex positivity. The following is an example from over 10 years ago where an entertainer emphasizes sexual health being important.
It's a beautiful thing the way the two of them sang about knowing. It's like freedom rang, strong the bond became, and they both felt good about knowing. Somehow the love felt more pure, like it was sure to endure, and now they were secure about knowing. It's like a gift from the sky, free they both can fly, and look each other in the eye. Now knowing is beautiful.
The steady conversation on social media in a layman's manner makes sexual health as prominent as just generic talk, as knowledge will induce confidence. This will happen by launching and promoting, which involves recruiting sex-positive experts, educators, research doctors, and sexually active and inactive people. Then the inception topics, asking open-ended questions on a Twitter platform such as, how is HIV transmitted and spread? Or what is the treatment for HIV called? The following topics will incorporate the other listed STDs and STIs as they increase your risk of contracting HIV and answer questions that weren't answered during the previous allotted talk time. Furthermore, to champion community proactive research, sharing credited links, finding sex health in popular culture, and making visits to the doctor or clinic as common as getting the flu shot. For example, if I ask, if health equals wealth, why do we risk it all on sex? What do you think your response would be? While you're thinking, I have an example of potentially how this conversation can get started. The goal for a projected reach is to average at least 20 participants a week for the first 4 weeks, then to increase 25% the next 8, 12, 16 weeks and beyond by reaching the audience of 18 to 40-year-olds in a familiar manner. This allows for observation and to see what myths are being shared and to gauge where to start educating. It also prompts users to Google search for information at the very least, then progress into focus groups that emulate social settings. The intended effect is to promote learning about HIV cure research and full sexual health, getting access to and navigating the healthcare system. By doing this, it is using education to combat fears and encourage responsibility. If you have any questions, you can email them to shyconversations@gmail.com, and please be sure to follow me on Twitter at Indiana Giordani, and be sure to join the hashtag every first and third Tuesday of the month at 9:30 p.m. starting December 6th. Thank you so much for your time.